next we have a very special guest. We have Dr. Shikha Sharma. Shikha ji, welcome. Welcome to today's conference.
Very happy to you are here. Very happy. Welcome. Please sharing your experience in what is your heart and mind. Welcome, Dr. Shikha.
Thank you so much, Swamiji, for inviting me. And it's an honor and a pleasure to be speaking on the forum with, Swamiji's blessing. So first, I'll give you a little backdrop about what I do. I'm a trained medical doctor in an allopath doctor. And my journey into health and healing began because I was working in the Department of Cardiology as a junior resident. And thereafter, seeing so many patients have heart attack and many of them passed away on the table, I realized that lifestyle disorders are most misunderstood as something which has to be treated in a hospital in an ICU, whereas lifestyle disorders have to be treated by lifestyle and not by medication. But this simple understanding is something which we don't see. It's right under our nose, but we don't see. So I decided to pursue a path of helping people follow better lifestyles, better nutrition. That was my beginning of my journey. And in nutrition, I also realized that there are two kinds of nutrition. One is nutrition to fill your stomach, to basically calories, which is just to stay alive, just to fuel your body. But then there is another kind of advanced nutrition. And that advanced nutrition does two things. One is heal your body. And when I'm talking about healing, I'm talking about healing of everything: wound healing, liver healing, kidney healing. So actually healing and repairing of the body. And something which I'll be sharing as I go along, the truths which I discovered in my journey is what I want to share. But before I go there, I want to share how I got to meet Swamiji. So Swamiji I met because of, I was being drawn towards the traditional systems of Vedic systems, and Swamiji's connection with the Aurobindo ashram and the classes is what drew me. And eventually, as I got deeper and deeper into the whole philosophy of integral health, which is a holistic health and not just treating a liver or treating a fever or treating a kidney, I realized that holistic is not only about treatment, which is its lowest denominator, but it is basically connecting with your soul and connecting with your soul purpose and fulfilling your soul's mission on earth while living a balanced and healthy life. So with that, I'm thank you, Swamiji, for keeping me connected to this beautiful institution and the work of the mother. So now I will start sharing some of the things which I understood. So to give a simple introduction, I'm a nutrition evangelist. Why? Because I'm not a nutritionist per se. I don't have a qualification in nutrition or dietetics. I have a qualification in modern medicine. But understanding the power of nutrition, and I've been in the last 25, 30 years, I've tried to interconnect traditional Vedic nutrition and Vedic systems of healing along with modern nutrition, along with modern healthcare. And this integration, which I'm trying to build, I'm evangelizing because everybody is a professional, the Ayurvedic doctors, the nutritionists, but I'm trying to connect all of them together and create an integrated system of nutrition and well-being and wellness. So first few things I feel that how do I, all the things which I've been understanding or which I have understood beyond the books, I think it comes from doing yoga with Swamiji. Because when you do yoga, I think a lot of inner intuition gets activated. And that intuition has led me to the right books, has led me to the right analysis, has led me to the right, what you can say, uh, differential diagnosis. So all these things, I think yoga has been a big help and support in opening those doors in my inner self, in my inner mind, where I could see things which a lot of people couldn't see uh, in their routine. So the first thing which I saw was that most of the time we are led to believe that nutrition is for calories. Nutrition is a fuel. I humbly like to state something else. My understanding about nutrition is that nutrition is actually the physical building block of the body. And the reference to Ayurveda, I would say that the physical body, the material body, the flesh and bones, what we see, is called the Annamaya Kosha in the Vedic studies. And itself, it reveals a lot. If the physical body is called the Annamaya Kosha, and Anna means food, then very clearly in the ancient system, they had figured out that the physical body is constructed from food material. And nowhere in health sciences, in especially anatomy or physiology, have I found any reference which would clearly state that the physical body, the flesh, the bones, is made from food. And yet in the Vedic studies, they have clearly said that our physical body, the raw material is food. And it is rewoven by our cosmic intelligence, by our DNAs, to form the liver, the kidney. So if the raw material is food of the physical body, that means if there is a liver damage or a kidney damage or any damage in the body, and the body has to heal itself, then we need the correct raw material in terms of the correct food. Which also leads me to realize that today the rise of cancer, the rise of kidney failure, the rise of many other diseases is because the whole communication pathway is being disrupted in the body. So the body is talking to itself. So within the body, there are millions and millions and millions of communication channels which are happening, whether it's hormones, whether it's biofeedback, whether it's neuronal feedback. And all these communication channels are closely linked to talk to each other. But what is disrupting these communication channels is chemicals in the food, whether it's artificial flavor or artificial preservative. Secondly, are the artificial hormones which are entering our bloodstream and our bodies. These artificial hormones are disrupting the entire chemical ecosystem, the messenger ecosystem, the biochemical messenger communication ecosystem of the body, and leading to the body systems being disrupted. So the problem of today is not calories. The problem of today is chemicals. And we have to refocus our thoughts on what is really harming humankind. It is not calories, it's chemicals. And those chemicals should be taken away from our food chain, whether it's a little baby having infant formula, whether it's a teenager having a snack which is full of preservatives and chemicals, or whether it's an elderly citizen recovering in the hospital and having chemical foods, whether it's a popsicle or a jelly or a gelato or whatever they're having, but there are chemicals in that food. It's not natural food. So that understanding came because as I was doing yoga, a lot of blockages were clearing out and I could see things very clearly. The second thing which I'd like to explain is that in my understanding, and also if you see the Vedic studies, it clearly says that the first physical body is Annamaya Kosha. And the second is the energy body, which is the Pranamaya Kosha. That means it is our breath which is giving power to us. And all this while we were thinking that the food is giving power to us. So the food is basically building the body, which is the conductor of this power. But the power is coming from breath. That is the engine of energy. The way we charge our mobile phones and our gadgets. So the charging station is our lungs, and the pranic energy we are breathing in and out. That is our power center. So if you're not breathing right, if you don't understand how to breathe, how can we heal our bodies? Because the power is coming from that breath. And technically, if you see, if a person doesn't eat for 35 days, then they may fall ill and die. 35 days, humans can live without food. A human can live only 3 days without water. That means water is more important than food. And finally, a human can only live 3 minutes without air. So air is actually what's keeping us alive. That's the pranic shakti which is keeping us alive. And yet we think that food is keeping us alive. Food is the body. Food is this house. It's the conductor of this energy, of keeping the atma and the body together, the atma and the sharir together. Because the construction of the sharir is through food. So I wanted to clarify that we need to go deep dive and understand the relevance and the correlation of how important is food in healing, in healthcare, and not just to fill our bellies. So I won't go deeper into the other koshas, because then it'll digress from my main topic, which is nutrition. But I also want to highlight that today when we talk about intermittent fasting, or we talk about many other things, it saddens me, because while fasting in every culture has a very valid space in terms of healing, but the way it has been misrepresented and as a shortcut to health, whether it's intermittent fasting or whether it's keto diets, they're causing more harm than help, because people do not understand how the body functions. While fasting is good, but in intermittent fasting, people are breaking the fast with the wrong kind of foods. So you cannot fast and then break the fast with the wrong kind of food. It's more damaging than helpful. And that is why a lot of inflammation is happening in the bodies. A lot of cardiac problems are happening. A lot of plaques are forming. Why? Because we are not following a particular structure as nature intended. We are disrupting the structure. We are using one tool and then not following up the. So after fasting, there is a protocol on how you have to break the fast to really get benefit of the fast. So you cannot have tea, coffee, or eggs, or spicy food after you break a fast, but people are doing that because they call it intermittent fasting. So having said that, because I run a company where we have treated lakhs of patients, and we have at any given point of time at least 2,000 patients who are actively engaged in the program of couple of months, I can tell that today one of the biggest reasons of the obesity pandemic is because we have not understood our bodies. Gut health is poorly understood. Gut-brain axis is poorly understood. The correlation of liver with gut is poorly understood. The correlation of liver and skin and kidney is poorly understood. The correlation of hormones and the hormonal change a woman undergoes is poorly understood. When I'm saying poorly understood, because it is understood in isolation, it is not understood as a human being, it's understood as an organ. When I studied medicine, I studied the hormonal system, the reproductive system, the liver system, but I did not understand, I was not taught the correlation between the liver and the brain, the correlation between the liver and stress and the intestine. So unless till the time we study subjects in silos, liver separately, kidney separately, pain mechanism separately, brain separately, and do not understand it as an integrated unit, we will continue to over medicate and not get the real result. will continue to do a stopgap arrangement and not actually treat the human being, but will keep trying to treat, or rather not even treat, mitigate symptoms of a particular body organ, whether it's a liver or a kidney. So what I'm saying is that this silo thinking, over specialization thinking without considering the whole human being, is what I see as a problem if we have to really give holistic healing to a patient. Till few years back, stress and the psychosomatic disorders were not even considered serious enough to be discussed in a hospital. So you can imagine how far away the surgeons are from a holistic way of understanding. It's only when doctors have a personal crisis in their families that they start looking at holistic solutions. So what I'm trying to say is not that what doctors are doing wrong, but what I'm saying is the doctors need the entire healthcare system, whether it is yoga, whether it is nutrition, whether it's Ayurveda, we all need to come together and speak a common language. And that language is of a human being and not a human body. So, like I said, my whole experience of doing yoga, my whole experience of connecting with Swamiji helped me not to think in isolation of I'm treating a liver or a kidney or a heart, but to think of the entire person as a mind, body, soul. So that integrated system of thinking has helped me to help our patients better. We also run courses in Vedic nutrition. So what we call the nutrition which I'm speaking about is called Vedic nutrition. And we are running a lot of certified courses in Vedic nutrition, where what as a doctor excited me is, number one, personalized nutrition. We talk about personalized nutrition and we talk about nutrigenetics. But what is very exciting is that in Vedas, personalized nutrition was talked about thousands of years back. And there was a structured and codified way of assessing different genotypes from the phenotype, which is called Vat, Pitta, and Kapha. Based on this, how different body types should eat. Like, for example, if a person who has been diagnosed as a Kapha genetic type or phenotype and has a lot of tendency for congestion and phlegm and water retention and obesity, eats a Kapha kind of food, let's say curd, in the Kapha type of season, let's say winter, in a Kapha type of time of the day, which is nighttime, which is nighttime, they'll get a Kapha disorder, which is lung congestion. So many children, when they have yogurt at night in winters, it's not surprising that they start getting tonsillitis or infection or congestion or sinusitis, because there is an overdose of a particular kind of energy in the body. Similarly, when we eat wrong food combinations, these days a lot of people are having smoothies. And if you're having a smoothie where we have milk and curd with fruits, it's going to cause more harm than good. It's a wrong food combination, apatya. So also, if I can request somebody from the organizers to just give me a signal at how much time is left so that I don't exceed my time. If somebody can just let me know.
Dr. Shikha ji, it's whenever you want to wrap up, that would be a good time.
Okay. So then I want to explain before I wrap up that there are 5 things which I want to highlight. First thing I want to highlight is that we should know our body type if we want to be healthy, because our body type is our code. It's our DNA code towards health. And with basis that body type, we should choose the kind of foods we are having. That's number 1. Number two, we should do the right food combinations, because wrong food combination is a bad reaction. It's something which can cause anything from arthritis to asthma to allergy. Third thing is, it has to be seasonal eating. We cannot eat the same foods all throughout the season. The food carry the energy of the season. So we have to eat seasonal. Third thing is, which is eating on the time of the day. That is very important. You have to eat according to the time of the day. The time of the day has its own energy. So our energy should be, the food energy should be aligned to the time of the day energies. And finally, I would say that all practices, nutrition practice, yogic practice, meditation, breathing, we all need to find our personalized formula. And if we find our own personalized formula, I think we will enjoy the bliss, the happiness of every moment, because we figured our personalized formula. So to honor ourselves, honor our bodies, honor our souls, honor our DNA, that is my final message. That nutrition, personal nutrition, is also honoring your body. And if we can move in that direction of honoring others and honoring ourselves, we will find a holistic way of health and healing. Thank you so much.
Thank you, Shikha ji. So, thank you so much. That was really insightful. Swamiji.
Yes, I am very happy. Dr. Shikha is very experienced in deep meditation and deep modern science. Have a bridge. So this time is very important to your experience in the world. In whole yoga world is very happy about your thoughts. Very happy. Thank you very much. Welcome. Welcome. Thank you.
Thank you, Swamiji. Swamiji.